Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, I'm Dr. Amal together with Dr. Tantri from Anatomical Pathology Department, Faculty of Medicine, Universitas Indonesia, Cipto Mangunkusumo Hospital. This is the introductory lecture for anatomical pathology practice with the topic female reproductive organ malignancy. In this video, I will present you three entities from female reproductive organ malignancy. The first one is Paget disease of the breast, and then adult granulosa cell tumor, and the last one is gestational choriocarcinoma. The other three cases of male reproductive organ malignancy will be delivered separately by Dr. Monique. So, our first topic is Paget disease of the breast. Paget disease is a malignant breast lesion which is characterized by proliferation of malignant glandular epithelium in the nipple areolar region. This lesion may expand to the surrounding epidermis or skin. Clinically, Paget disease manifested as erosive, crusted erythematous lesion like this in the nipple, and sometimes accompanied by nipple discharge or nipple retraction. Most of memory Paget disease derive from other lesions such as ductal carcinoma in situ or DCIS like this, or invasive carcinoma in the breast parenchyma. This underlying lesion will not be demonstrated in this lab work. They will be presented in hematology-oncology module instead. These are microscopic picture of Paget disease of the breast. You can differentiate the normal epidermis here from the one that infiltrated by malignant cells or Paget cells here. This picture shows erosive epidermis. We can hardly see the normal epidermis anymore, and there are abundant malignant cells that look paler than the surrounding. This is the normal skin of the breast. Breast tissue is covered by keratinized, stratified squamous epithelium. And beneath the epithelium, we can see the stroma consists of connective tissue. This is the Paget disease lesion. The epidermis become erosive and there are many malignant cells infiltrated the normal epidermis. We can see that the Paget cells have abundant pale pink cytoplasm. In the higher magnification, we can see the difference between normal epidermal cells and the Paget cell. Here is the remnant of normal epidermis. Look at the small cells with small blue nuclei compared to the Paget cells that scatter around the epidermis. Paget cells and their nuclei look much larger than the normal cells. Note the color of their cytoplasm, pale eosinophilic. This picture shows how enormous Paget cells are compared to the normal cells. This is the Paget cells. They look much bigger than the remnant of normal epidermal cells here, or even the inflammatory cells here. We can also see the part of stromal tissue. Here's the stromal tissue with abundant chronic inflammatory cells and the acute inflammatory cells here that infiltrated the epidermis too. Now we move to adult granulosa cell tumor. Ovarian tumor may arise from various tissue within the ovary. They may arise from the surface epithelium or epithelial cells, or the germ cells here, or the sex cord, the cells that covering the ovarian follicles, and stromal cells, sex cord and stromal cells tumor, and also the tumors that derive from other organs or metastasis. In this lab work, we will only talk about one of the sex cord tumor called adult granulosa cell tumor. Adult granulosa cell tumor most commonly occurs in perimenopausal women with symptoms of abdominal pain or abnormal uterine bleeding. Why do some patients got abnormal bleeding? Well, the tumor cells of AGCD produce estrogen. The consequence of increased estrogen level is thickening of endometrial layer of uterus, which is known as endometrial hyperplasia. It causes the abnormal uterine bleeding. The patient may have heavy, prolonged bleeding and sometimes beyond the normal menstrual cycle. The estrogen level increase can also give rise to other malignancies such as endometrial carcinoma and breast carcinoma. Granulosa cell tumor may also occur in pediatric, the juvenile granulosa cell tumor, for example. In this case, the patients may have precocious puberty as the result of estrogen level increase. They will have early menarche and got early secondary sexual characteristics like breast development. Adult granulosa cell tumor usually unilateral. That means that only affect one side of ovary with mean diameter 10 centimeters. But it can grow bigger and reaching a sizable mass. On a cut surface, the tumor is solid with soft consistency, brown to yellow color, and may have hemorrhagic area, like here. We can also find some cystic spaces. Microscopically, AGCD forms solid or insular growth among the fibrometastoma. This is the higher magnification where we can observe the solid growth of the tumor, and here's the fibrometastoma. This area shows multiple hole-like structures, like small cavities filled with eosinophilic or basophilic material. We can see the pink or bluish material within the lumen. These structures called microfollicular or Kohl-Exner bodies. This is the Kohl-Exner bodies. The tumor cells are malignant granulosa cells with some characteristics like uniform round to oval nuclei. They have irregular nuclear membrane and shows nuclear groove. Here's a nuclear groove, another one, resembling coffee beans. They have only scant cytoplasm. Please have a closer look of the tumor pattern, the Kohl-Exner bodies, and the granulosa cells, round to oval uniform cells with nuclear groove. This is the last neoplasm will be discussed, the gestational choriocarcinoma. Choriocarcinoma is a malignant neoplasm of trophoblastic cells. You have to remember that in this tumor, we cannot see any chorionic villi. They have tendency to invade blood vessels, so they can metastasize widely. There are two main types of choriocarcinoma. The first one is the gestational type that associated with pregnancy, normal or abnormal one. Most likely is the complete molar pregnancy. They usually have excellent prognosis compared to the other type, the non-gestational, that usually bear poor prognosis. The clinical findings of choriocarcinoma are various. We can find vaginal bleeding up to several months after pregnancy, or the symptoms that related to the metastasis. If the choriocarcinoma has metastasized to distant organs such as lungs, they can make shortness of breath in the patient, and other symptoms that related to high HCG levels, because the tumor cells in choriocarcinoma produce human chorionic gonadotropin. This is the microscopic specimen of choriocarcinoma. This is uterus. The cervix, this is the cervical canal, and this is the uterine cavity. This is the uterine wall. In this specimen, we observe the tumor mass in the uterine fundus that contain necrosis and hemorrhage. The tumor grows toward the uterine cavity while invading the myometrium here. In this microscopic picture, we can see the tumor mass that infiltrating the myometrium. Here the myometrium, the tumor mass. And they also invaded the blood vessel. Here we can see the tumor inside vascular channel. This vascular invasion shows the propensity of the tumor to metastasize, spreading to the distant organs. In this higher magnification, we can appreciate two distinct tumor cell types. The first one, the round vesicular mononucleated cells with slightly clear cytoplasm here. They're surrounded by the other type of the cells, which have hyperchromatic or dark nuclei. Some are multinucleated, like here, and they have bright pink cytoplasm with indistinct cell borders. Could you name those two cell types? They are mononuclear trophoblasts, cyto and intermediate trophoblasts that rimmed by syncytiotrophoblasts. So the clearer one is the cytotrophoblast or intermediate trophoblast, and the bright pink one is the syncytiotrophoblasts. And you have to remember that in this tumor, we cannot see any chorionic villi. Cytotrophoblasts have smaller uniform nuclei than the intermediate trophoblasts, while the intermediate trophoblasts have more clear cytoplasm. Here are the cytotrophoblasts. Take a look at the small nuclei, quite uniform, and they seem like tightly packed compared to the intermediate trophoblasts that have more cytoplasm. Cytoplasms are clear here, and this is the syncytiotrophoblasts, which have the bright pink cytoplasm, and sometimes they are multinucleated. This is the higher magnification of the tumor, where you can see the mononuclear trophoblasts, that are rimmed or surrounded by the syncytial trophoblast. Okay, that's all for female reproductive organ neoplasm lab work. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.